Today we're going to be talking about toothpaste. My name is Caitlin Connors.
And I'm Sydney Fry. Toothpaste is used to promote oral hygiene. It's an abrasive that aids in removing dental plaque and food from the teeth. It assists in suppressing halitosis and delivers active ingredients to help prevent tooth decay and gum disease. Some top whitening toothpaste brands that we found were Colgate, Crest, Arm & Hammer, Pepsodent, Tom's of Maine. Some sensitivity toothpaste were Sensodyne, Pepsodent, Tom's of Maine. And some top brands that don't specialize in any specific concern that we call regular toothpaste are Close-Up, Aim, Pepsodent, and Tom's of Maine.
This chart presents prices of specific toothpaste from the different brands we have mentioned. It's important to notice the differences in sizes when comparing, as toothpaste can come in a variety of sizes. Although the average tube holds 100 milliliters of toothpaste, we decided to go with Walmart, Shoppers, and Amazon for our prices. This is how we decided to compare products with each other. After doing some research online, we came across some of the best toothpaste brands that were based off of consumer reviews. For general use, people like the Crest Pro Health Clean Mint. For sensitive teeth, Sensodyne Pronamel Fresh Breath Toothpaste. For whitening toothpaste, Tom's of Maine Simply White Natural Fluoride Toothpaste in Sweet Mint. And for natural toothpaste, the Natural Dentist Healthy Teeth and Gums Anti-Cavity Toothpaste in Peppermint Twist. Some active ingredients in toothpaste are abrasives, which are used to remove plaque and tartar. They give toothpaste their cleaning power. Coloring agents add visual appeal to the toothpaste. Detergents are also referred as soaps, foaming agents, or surfactants. Humectants are used to maintain a consistent paste-like texture in toothpaste. Flavoring is included to improve the taste of toothpaste. Fluoride works to prevent decay. Preservatives are included to prevent the growth of microorganisms in the toothpaste. And sweeteners are only intended to improve taste. Whiteners are added to the toothpaste but cannot actually whiten teeth. Instead, whiteners work to reduce stains.
Companies advertise to the entire public. They target mostly adults by using different tactics, for example, making it seem important of having fresh breath or a good smile. They use specific concerns, which could be sensitivity. They show a dramatization of results, so yellow teeth transformed into white teeth by using a whitening toothpaste. And children are usually advertised through exciting flavors, characters, or themes.
How to use the product. So first you want to wet the toothbrush and apply the toothpaste. Often too much is used and you only really need a pea-sized amount. Depending on what concerns you might have, you could use different toothbrushing methods. The modified Bass method if you have no recession, the Stoneman's method if you have periodontal concerns, the Phones method for children.
There are many different advertisements shown in different ways for toothpaste. Some include commercials seen on TV, poster ads in dental offices, online ads, and in magazines. Below is a Sensodyne ad. It targets people who have sensitivity and want to overcome it. A dentist recommends the product by making the audience believe that it's more reliable.
When the tooth is sensitive, it should be treated. It's a call for help. It's telling you that you need to treat that. And if you don't, then, more harm can come to the tooth. I recommend Sensodyne Complete Protection. Not only can you treat the hypersensitivity, it'll also help all the supporting structures around there. It brings everything together that we want out of a toothpaste. I think patients will absolutely want to keep using it day after day after day. Sensodyne Complete Protection to me is the complete picture. So why would I recommend anything else?
So this Crest advertisement targets people who want whiter teeth. They include a celebrity in the ad, making it more appealing to the audience.
So for our research, we found 2 articles. The first one called Triclosan Copolymer Containing Toothpaste for Oral Health. This is a study published by the Cochrane Database of Systematic Review. It is about the effects of triclosan copolymer toothpaste on oral health. They compared fluoride toothpaste with and without the substance together. The study included data from 30 separate experiments that conclusively displayed that the toothpaste containing triclosan and fluoride had a reduction in plaque, gingivitis, bleeding gums, and reduction in tooth decay. The second article we chose is called Fluoride, published by the Oral Health Foundation. It discusses what fluoride is, the benefits, where it can be found, the amounts in water and toothpaste, and discusses the safety of fluoride. This article uses evidence to determine fluoride is safe and beneficial for oral health in both ways of water supplies and toothpaste. Overall, the benefits are overwhelming evidence proving fluoride aids in reducing both tooth decay and caries. The Oral Health Foundation promotes the incorporation of fluoride in toothpaste and water supplies. In this video, we're going to show you how to properly use toothpaste. Okay, so first you're going to want to wet your brush and then apply a small pea-sized amount of toothpaste. Today we're using Crest Gum Detoxify. And you can just brush how you normally would. In this video, we are showing modified baths. And once you're done brushing, you can spit and rinse if you'd like.
These are all the references that we used for the presentation. Thanks for watching.